Uganda is hosting over 1.2 million refugees, mainly from South Sudan and the Democratic Republic of Congo. Hosting districts are increasingly experiencing pressure exerted by the influx of refugees as they are bound to share existing facilities like schools, water sources, and health facilities, among others. Uganda's refugee law, for example, grants refugees rights to the same social services as host population, including using available public health services. Adjumani is one such district with about 4,318 refugees, most of whom from South Sudan, through a leg border. At Maji 3 Health Center 2 in Adjumani district, health workers at this makeshift medical facility continue to save lives despite challenges.
Our main target are the refugees, of course, and then few members from the host community, and then particularly children, overload our health facility in terms of diseases. The greatest challenge we have is malaria. Malaria is very common, and most people who come to the health facility, like particularly at this month, 75% of the clients that come are having malaria.
Tako Stephen, a clinical officer here, calls for permanent structures to better service delivery, especially to mothers.
Right now, we have a challenge with the department because we are unable to conduct planned deliveries here because of the setup of the place. The place is very small. We only conduct emergency deliveries, and yet there are very many pregnant mothers here. So they have to walk all the way from here up to Maji 2 for deliveries. So that has been the cry of the community, and also it will be my cry that let's put a structure for the humanitarian department such that these mothers are served from within.
At Mungula Health Center 4, the impact of refugee influx is felt especially in the maternity ward that previously used to serving a catchment population of about 640 patients.
But now our average deliveries have gone to 75. And when you take the labor room, it is so squeezed and small that it only fits one bed. And at times you have 3 deliveries at a time. Secondly, human resource. The number of deliveries increase every month, but the number of the health workers remains stagnant.
However, with support from United Nations Population Fund in training midwives and providing some medical essentials, the situation is improving. Mayamba Dennis, a male midwife working at Mungula Health Center 4, was recruited in 2014 through a UNFPA midwives program.
I'm here because UNFPA came in to give a hand because of the influx of South Sudanese. So they saw a need of having midwives. They have given us the referral system, also the ambulance that picks our mothers from the communities, those ones who are unable to reach the facility.
At Pagirinya Health Center 3, language barrier was cited as a major problem affecting services.
Sometimes in a night where there are no translators, you are alone as the midwife, you don't know the language, you gamble. A mother is ending up doing her own things because of language barrier.
They still have that mentality that the coach, however much the coach is there, for them they have the mentality that they want to deliver from down. You put someone on bed, someone jumps down when feels that stage is almost second stage, the baby coming out, the person's jumped off. That is the tradition they are normally having where in Sudan.
Titus Jogo, a refugee desk officer at Adjumani, says strengthening health systems among refugees and host communities is something they are taking seriously.
We cannot just look at supporting refugees alone. We also need to look behind and say, yes, there's this host community which has been very generous. They have given us land. They are peacefully coexisting with the refugees here. So, to encourage peaceful coexistence, we need to balance the equation. If we are planning for drugs in the health centers within the refugee settlement, it must be for all. So when we talk of 200,000 refugees here, we also don't forget the other over 200,000 members of the what? Of the host community, because they are equally affected by the presence of the refugees in the settlements, and they have also not come out of that levels of what? Of poverty.
Uganda is currently ranked as the second largest refugee hosting country in the world, with a refugee population of over 1.2 million. According to United Nations High Commissioner for Refugees, the country received more than 500,000 fresh refugees from South Sudan since fighting broke out in 2013, and most recently over 1,300 have been arriving every day in the wake of fresh fighting. Bernard Iga, UBC TV, reporting.